fentanyl, as you've all heard, and 100,000 deaths the last 2 years in America alone due to adulteration with fentanyl and other serious drugs. So that is the mission of the GPF Foundation. We basically, we like to think of it as a three-legged stool with respect to our educational tools that we've created. The first is delivering a format to those who are most likely to utilize recreational drugs, 15 to 30, 35-year-olds. And we educate them with facts and figures and signs and signals so that hopefully if they still choose to party and use, that they do so more safely and with more thought. And should something still go wrong, understand what that looks like, and their peers understand that and know where to get help. We don't condone nor condemn the use of drugs. We're neutral with regard to that. Our mission is education. That's one leg of the stool. Second leg is to address the medical community because, as Nancy mentioned, our son was steered the wrong way by his primary care physician, who had no understanding of the situation. And we subsequently were informed by significant medical practitioners that there is a blind spot in the medical world related to recreational drugs and adulteration. So the second leg of this so-called stool is to educate the medical community. We built an app with a simulated tool that has Greg's story on this app, and it's carried on a specialized platform that medical professionals worldwide can subscribe to and utilize it for training purposes. And we're very proud to say that after about a year and a half, that tool has been utilized and played by appropriate practitioners around the world over 130,000 times. So we know that that is a direct hit in the medical community. And the third leg of the stool is this. It is an educational presentation that you'll hear from Brianna shortly, which we've just rolled out. It's the last of our programs to roll out. We're still learning, very new. We appreciate your interest and of course your feedback. And it's to educate first responders, such as yourself, police, fire, EMT, who are the first on the scene often for these type of emergencies, and what they should be looking for and understand. And so with that, we think that we're really providing the educational tools to address this situation. The foundation does quite a bit more as well. We publish, we research, and we hold events, and we've come a long way. But again, thank you for being here.
I want to thank Lou for this. Looks like you walked out.
Right. Thank you, Brianna.
Are you good? Or
I was under the impression that there would be a team like work, and so we're going to try to do our best.
Okay. You'll do great. Thank you, Brianna.
Of course. So I'm going to go around with my laptop, and there's a QR code on here that if you would so kindly take out your phones and scan. It is I think a 6-question, not a test that's graded, but it's a test to see going into the presentation what type of knowledge you guys already have about the subject. Just take your time. You open your camera. Okay, so you put it in front, and then you don't think like you see a little yellow thing right here. There you go. There you go. Perfect.
Thank you.
When you guys are ready with your phone, a little yellow link will appear. We're doing our best for today. Technical difficulties. Does it open up a little link for you? Okay. Like this. Which a lot of this is yellow link.
Yeah.
He says on that yellow link.
There? No, there was a yellow link on the top of the.
Okay.
Comes in the rows. No, it was a whole yellow. Next time. It was, took it away and put it on again. Not take it, it's the little thing from up. Not there. You and I will share.
Unfortunately, that's how we
So,
Let's get this out.
It's not the camera.
Stand for it.
Oh,
Yeah.
okay. Can you go to your regular?
Full of power. Power cable and box.
Came up.
You know what it? Oh,
You're on.
Well.
So I give it to
Yeah, you go.
All right, Brad, here's your screen here.
Okay, now, Google Documents.
Can we,
You wanna try it up there?
Go to the.
Yes, thank you.
who else needs this? I'm just, you make that one work?
Especially.
Sure. But that didn't work?
Just go. I accidentally. In her sister's house. Where we got. I'm swimming with the phone.
Does it work here?
I run over. With our band.
No, the one he said.
Just got a big.
Does it have a BCA? Does it have a BCA? All right. Okay. All right.
I didn't like that either. You should be able to.
Yeah, it's not working.
They must work.
I'm not recording, by the way, this is just a Zoom meeting, just so you guys know. So I'll start off by introducing myself while he's doing that. So my name is Brianna Lopez. I'm a fellow with the foundation. I'm currently doing my second year of my master's in clinical counseling at Rosalind Franklin University of Medicine and Science. My background is in psychology, and my other background is in criminology and criminal justice from Arizona State University. I'm currently doing my internship at Lake County Health Department with their substance abuse program. In Arizona, before coming out here, I was a substance abuse counselor. I managed over 130 clients a month, which was very overwhelming, but it was what I did. And then after that, I spent extensive time in the prisons in Arizona doing recreational therapy with the inmates there. That was a very rewarding experience. Learned a lot. My personal connection to this world runs very deep, so I'll just try to keep it very brief. My father was an alcoholic. My grandfather was an alcoholic. My oldest brother dabbled a lot in recreational drug use, and it could have been very easily the same experience that they have had with their son. And couldn't even imagine losing my brother. But at the time when we were younger, we didn't really have this type of information available to us. It wasn't really a reality that we lived in as far as the adulteration of substances that we see today. So obviously that expanding and that being a huge problem now, it's very necessary for us to have some type of education both in the community and also with our first responders who are going to be in situations where they actually are able to help those people that are in need. So again, thank you all for being here today. I know it's a little bit late in the day, so thank you guys for giving us your time. I really, really appreciate it. So today we are going to start off with a video that I'm going to try my best for you all to see. It is about the mission of the GPF Foundation and why we are here today. It says, I'll read it for you guys. It says, we are working in spirit towards a future where the public and medical communities have the awareness to prevent loss of life from recreational drugs. Our vision is to save lives through awareness.
In the summer of 2017, Greg Friedman was in the prime of life, getting ready to propose marriage, working in the own and expressing his artistic talents.
He just was a beautiful road. To a great place.
A story that begins at a concert. Greg, his siblings, and their significant others attended together in San Francisco, plus a buddy from high school who brought ecstasy.
Greg mentioned, please, no need. This group does not need that drug tonight. The individual, unfortunately, showed up late to the concert to rendezvous we had the purchased and concealed on the streets of San Francisco. And Greg unwisely shared it with his friend. Greg immediately expressed signs of significant physical and mental distress. The next morning, apparently, he appeared recovered. However, unbeknownst to others, he was still reeling. He needed appropriate treatment. Unfortunately, he didn't find it.
Sadly, Greg was very far from alone in his decision situation. Like millions of other people every year taking Molly, what he thought was pure MDMA was almost certainly adulterated.
It's not like I'm like an addict or anything. It's just I work hard Monday through Friday. I work 2 jobs Monday through Friday. So it's like Saturday and Sunday. If I want to play, I think I deserve to play.
I do have some friends who had some bad experiences with it, but I have never personally experienced anything like that. I think it's responsible when I take it. I think you can take it right now because it's popular. It's not too expensive. Like Molly, like drug of the plant, and like you don't know what you're actually like doing. People like CPR. You may be like tripping or freaking out, and they don't know how to help you. So like it can become like a serious emergency.
We really do need effective harm reduction efforts. Many people are self-medicating or going through underground sources and really need to be educated and informed about the potential harms and risks.
My presentation is on the study of the effectiveness of the GPF Foundation educational program on MDMA. What we found through this study is that educational group sessions can significantly increase students' knowledge of MDMA in a lasting manner. Things like the adulterations that are possible with MDMA, the side effects, that includes long-term, short-term, as well as what to do if an individual chooses to consume MDMA and how to care for an individual.
I learned from the poster presentation that the GPF Foundation is focused on educating users and professionals about recreational MDMA usage. I think as students, we're so conditioned to listening to lectures and to have something like that stick. It's vitally important as we go on in our futures and make our own adult choices. So something that sticks as well as that presentation did and that education did is really important.
All right. So just to make sure that I covered everything. So building off the dedication that Nancy and Ross have put into creating this foundation, we created, these types of trainings for first responders because we believe that you guys are going to be the first ones, for the most part, to be able to, assist us with someone who's in a substance use emergency. And so we're doing our best to go around and try to make connections with different, organizations, even police officers and stuff like we've already talked about, to just create those bonds so that we can try to, be a part of the solution instead of the problem. So today we're going to start off with hallucinogens because of the similarities in the physiological responses that you see as far as stimulants and hallucinogens. So hallucinogens, again, like I said, are very similar to stimulants. They heighten your body's functions, but again, they're not as obvious because they're more physiological. Their heart rate will increase, they'll start sweating, they'll start looking a little bit flushed. Examples of hallucinogens are PCP, LSD, or acid, MDMA or ecstasy, as we've already spoken about, and mushrooms. I'm going to play another video about hallucinogens so you guys can kind of see in a real world perspective what somebody on hallucinogens would look like. And we'll talk about these slides that are appearing right here in a couple moments. We'll go over them in detail.
Excuse me, can I? Go ahead, we'll see.
I'll try my best. I'll try my best.
Maybe hold on.
Like this? How about, is that clear? Oh, if I finish the lights off, I will. Just tell me when.
In the back.
In the back?
Maybe you just read it. Yeah, I think just read it.
I'm gonna go over the slides after the video. It's just that they appear in the beginning of the video. There we go. Is that better? Yeah? Okay, sounds good. So you don't need to read these for now. We'll go over those slides together. But this is an example.
All of us. Same time lapse of frame. It's like kind of combined. I felt like once in the world, and like once in all this other shit, all our children, like enemies, we're all together. There's one thing, so you know the saying like, actually on maple syrup, it's like, that now they're spotting everyone. They're spotting what everyone needs to do. They can see like something is going there. I don't know what the fuck's going on over there. That's just dark.
So that was just a real world example of what somebody on a hallucinogen would look like. So they obviously appear like they're not in this world. When they're trying to speak, you can't really understand them because of their line of thinking isn't straight, like someone who is not on a substance, like us right now. We can speak directly, our thoughts can come out in a coherent way, but when someone's on hallucinogens, it can be really difficult for them to create a thought and get it out properly. So the first thing that you're going to notice when someone is on a hallucinogen is that their pupils are going to be really big, really, really big. They're going to obviously be experiencing confusion, like you just saw in the video. And the problem comes when they start to experience paranoia, where they feel like someone is coming after them, or they can't trust even the person that they came to the event with, or the situation that they're at. They can't even trust the people. They start to experience paranoia. And the other thing is when they'll start having visual and auditory hallucinations. They'll start to speak to things that aren't there, or they'll see things that aren't there. And that's when a combination of these things will let you know that this person needs some help. The really important thing that I really want to focus on, though, is that patients with schizophrenia and other psychiatric illnesses will appear the exact same way, and it can be really difficult to differentiate between them. We just have to do our best. It's really difficult, honestly, even for somebody like me who is trained in mental health professional things. It's still really difficult to differentiate between the two. We just have to try to really assess the situation. Are they excessively sweating? Is their heart rate going crazy? Like, those are the things we're going to let you know this person needs medical assistance. So again, we're gonna go over how to help someone who is experiencing an emergency on hallucinogens. 3 things to remember. So obviously they're experiencing a lot of stimulation. What we want to do when we approach someone who we are seeing might need help is to use a calm voice. Since they're already really stimulated, if you come in aggressively or trying to overwhelm them, it'll do the complete opposite effect of trying to help them, right? So we want to approach them with kind of a calmer voice, kind of just like bringing down that stimulation that's going on in their body. Another thing is about the way, again, you speak to them, having a conversation with only 1 to 2 people. You don't want to overcrowd them with 6, 7 people that are here trying to help them all at once. Again, they're overstimulated. They can't have 6, 7 people in front of them because it'll be too much. If there is a need for that many people to be there, the rest of the people can kind of hang around in the background just to like be there. If they need to step up, they can, but they have to mostly, for the most part, stay in the back while 1 to 2 people is in front of them having that conversation with them. And a lot of paranoia, again, is going to be involved here. So you want to reduce that by reassuring them as much as you can, letting them know that you're there to actually help them, that you're not there to hurt them in any way, that they're okay, that they're safe. So that those things will help kind of reduce that paranoia as much or as little as possible is still to the benefit of that person. And when EMS arrives, they'll most likely give them benzodiazepines because benzodiazepines will bring down your stimulation in your body. All right, now we're going to move on to stimulants. So the basic things about stimulants is that it's otherwise known as, let me try to pronounce this word, I always have a hard time with it, sympathomimetics. So sympatho has to do with your sympathetic nervous system, and mimetics have to do with your body's movements. So we're going to watch a short video on somebody who's actually experiencing those kinds of things. We'll get into the details of those kinds of things that I just mentioned, but this is a real life example of somebody who is on stimulants and is kind of a little bit out of it, to keep it brief. Let me see if I can play this video. One second. Technical difficulties again. Again, we'll go over these slides after this. Don't pay attention to the slides. Okay, so in the video, you can kind of tell he's bending over a lot. He's kind of just like moving in a little bit erratic way, not too excessively, but it's still there. You can still see how he's a little bit, his movements are a little bit different than somebody who's not on drugs, obviously. So examples of stimulants are methamphetamines and amphetamines, Ritalin and any other ADHD medications, cocaine, ecstasy, and caffeine. And notice that not all of these are illicit drugs. They most oftentimes are not always illicit drugs in the recreational drug world. Especially, like I said, Ritalin and ADHD medications, obviously those are prescribed to people, and if they're abused, they can become a tool for recreational enjoyment rather than for medical purposes. And especially caffeine. So I don't know if you guys know anybody, but I do as a student. I know a lot of people who drink at least 4 or 5 monsters a day. But some people actually drink 7, 8, 9 a day. And so somebody who drinks that many monsters or energy drinks can actually experience or exert the same type of symptoms as somebody who has actually taken a stimulant. So sometimes you won't know, has this person drank 20 cups of coffee or have they taken cocaine? It's really difficult to differentiate because caffeine is actually a stimulant. That's why we wake up in the morning when we drink a cup of coffee. And we won't know exactly what they took until we take them to the ER and they do a urine analysis on them. Something that most people don't know about. So these are the symptoms and appearances I'll read them for you because they're obviously very small. Of somebody who's on a stimulant. So it's almost the same as hallucinogens again. Their pupils will be really, really, really big, almost to the point where you can't see the color of their eyes. They'll be really agitated. They will have tachycardia, so their heart will be really, really fast. So that causes excessive sweating, and also for them to be extremely hot to the touch. Something that helps in the moment is for you to wet a rag, a t-shirt, a piece of cloth, whatever, and put it on the back of their neck. It helps bring down that temperature and cool some of the stimulation that's going on in their body. But again, it's the combination of all five, because sometimes it's four, so I get confused. So the, what is it called? The combination of all five of these in one person, that's when that person needs medical attention. Mydriasis will sometimes always be normal for somebody who has taken stimulants or hallucinogens. But again, the presence of all five is what you need to look out for, and that's when that person needs a medical emergency intervention. And so how do we help someone that has experienced a emergency when they've taken stimulants? So again, like I said in the beginning, it's very similar to hallucinogens. You want to lower your voice to calm the stimulation within them. Again, the same thing with the conversation part. You want to have 1 to 2 people speaking in front of them, the rest of the group kind of staying in the back, and giving them simple guidance. Giving them like, hey, can you sit down for me? Instead of saying, hey, you sit down for me because we need to do this, we need to do that, we need to do that. Like one step at a time for them. Again, because they're overly stimulated, and if someone is extremely agitated with you, probably not going to listen to you if you give them 7 orders at the same time. Again, a lot of reducing the paranoia. You want to reassure them that they're safe, that it's okay where they are with you, that you're there to help them, things like that, just to reassure somebody that they're in a safe space with somebody who's there to assist them. And then again, cool them, like I said, with a damp rag, a damp towel. That's like the quickest, fastest thing that you can do for somebody who's experiencing this type of emergency. When EMS comes on scene, the most likely thing that they will do is give them IV fluids, because they'll be sweating a lot, obviously, so they'll get dehydrated really fast. And then also give them benzodiazepines to kind of, but they'll also do it in a very small dose, because when you mix stimulants and benzodiazepines, it can be life-threatening. So the medical providers will do that at their own discretion, at their own pace. All right, so now we're going to move on to depressants. I'm going to show you guys another short video, just to give you guys a real life example again of what somebody on a depressant would look like. And again, these slides I will go over, so do not worry about reading them. This is somebody who has experienced an overdose.
Yeah, that's the point. Okay, more than left nostril. Right, but there you go. There we go. Hold on.
All right, so like I said, that was a video of somebody who had experienced an overdose, and thankfully was able to get the help that he needed from the police officers that he saw that they administered Narcan, and they were able to bring him back to life. A few things that I want to point out from that video before getting into the basics of this is actually a question. Have you guys ever encountered Narcan at all? Have you heard of Narcan?
Mm-hmm.
Yeah. Okay, do you guys receive training on Narcan as well?
Mm-hmm.
Awesome, that's great. I really appreciate that for the community. Thank you so much. But again, I just want to point out a few things just as a refresher. Initially, when they took him out of the car, you guys saw that they had kind of stimulated this area of his body. You would make a knuckle, you'd bring out your fist, and right under their breastbone, you would press really, really hard, because normally that would wake anybody up in any other type of circumstance. If they do not respond to that, that's when you know, okay, this person is not going to wake up. They're probably experiencing this overdose. We really need to administer Narcan. That's like the most basic thing that you can know to wake them up. And if they don't wake up, they need Narcan. And even if you suspect that it's an overdose and it might not be, when you use Narcan, it's not going to affect them in any type of negative way, even if they're not experiencing an overdose. It won't hurt them at all. Just do it if you think it's necessary. All right, so now let's get into the basics. So obviously your body will lower its functions, like we've already talked about with benzodiazepines. Your stimulation and your nervous system will go down. They'll lower, is what I'm trying to say. So examples of depressants are opiates, most commonly known nowadays, right? Opiates like heroin, morphine, fentanyl, codeine, Vicodin, and Percocets, which codeine and Vicodin and Percocets are prescribed. Sedatives like benzos like Xanax, Ativan, Valium, and Klonopin, and also anti-seizure medications. This is actually something that people don't know about, so it's very common that this can happen and be abused with those type of medications, and also muscle relaxants. Those are also not very commonly known, but I'm happy that we have them in the presentation. So these are also the symptoms, and again, I'll go over them because I know it's hard. Go ahead.
Alcohol.
Absolutely, alcohol, yes. And it was funny because I was doing a presentation the other day with high school kids, and they were like, well, you can't overdose on alcohol. I'm like, yes, you can. But yeah, that was a funny circumstance. So it's actually the opposite with what's going to happen with the eyes. Their pupils will get really, really, really small. That's why the police officers, I don't know if you guys were able to see, but they checked their eyes and they said, yes, they're pinpointed. So they knew that it was opiates right away, or depressants. Their breathing is going to get really slow. Again, all their bodily functions will start to lower. Their breathing will get slow. Their temperature of their body will go into almost a hypothermic state. Their level of arousal, meaning their ability to respond to you or to cooperate with you, will be almost non-existent. And also they'll have either slow or no movements. So again, a combination of all 5 of these symptoms will tell you, hey, this person is experiencing a medical emergency. We need them to get the care that they need, or we need to do whatever we can in the moment while we wait for EMS to come and help us. So how can we help again? So if they're not breathing or if you have no heartbeat, you're gonna want to open an airway. So you saw the police officers, they pulled them out of the car and they laid them on his back. And then you didn't see this in the video, but to open the airway, you want to put one hand on the bottom of their chin and the other on the back of their head like this, and you want to bring it up. That way it opens the airway, right? Because when we're like this, it's like our airway's like that, right? So we want to open it up and make sure that they can at least get some type of breathing in there, because again, in the video, if you were able to hear his breathing, it was really like croaky sounding. I forget the technical term for it, but he could barely get any air into his lungs. So we want to try to help him or her in any type of way to get that air into their lungs. And you also want to begin chest compressions or rescue breaths, if necessary, or honestly at all times. The next thing, again, is about Narcan. We already went over that. I'm thankful that you guys have a little bit of training in that, or a lot of training, or any training at all. It's just an awesome thing to see every time we encounter, organizations that are out to be first responders. So I really appreciate that. But the most important thing is that nowadays, like I said before in the presentation, when I was younger, and I'm not even that old, but when I was younger, we didn't have adulterated drugs. That was not a conversation that was spoken about, but over the last 10 years, that has been something that's become very common in our society. Adulteration, in another word, is laced, meaning that there are mixtures of drugs in a substance, and we often don't know what is in that substance. So most likely, the thing that it would be laced with is fentanyl. We've all heard of fentanyl, I'm assuming. A lot of the times in clandestine labs where these substances are being produced, they're often made or packaged, if you want to say, or produced on the same table, and they don't normally clean up that table, right? Like, they're not regulated by the FDA, so they often get mixed, and it's even all the way down from marijuana all the way up to hallucinogens, depressants, and stimulants that we're talking about today. So it can be laced with anything, and we'll never really know unless the community knows about testing and how to make sure that their drug isn't laced with fentanyl or anything like that, which is why we do the community training so that we can educate people on how to do things in a smart way and to not risk their lives if they're trying to just have a experience with a recreational drug. And where do you want to go? So, but again, when EMS comes on the scene, again, if necessary, they'll find a definitive airway, which most likely they'll do like a trach or something in the throat. All right, so now we got to the fun part, my favorite, the discussion. So I just have two questions for you. Hopefully we can share some experiences that you guys have seen in the field yourself, or if maybe you guys have some questions for me, absolutely free to do it. I'm open to everything and anything you guys have to say. The first question is, what are some experiences from the field that you have related to Greg's story or substances discussed today? Really, I need the water. It's not stuttering. I'm sorry. Oh, thank you. I'm like, I appreciate that. Thank you so much. But again, I just was wondering, like, have you guys ever had any experiences with the field that you guys are working in today, as far as like relation to Greg's story or substances in general? Anybody? Jump in.
I was a former police officer, and I currently work in Lake County probation. I deal with it on a daily basis. I get people walking in, and a lot of people I test, and I know that I can tell by looking at them and seeing sometimes I just decide to test them for fentanyl, and sometimes they're surprised they test positive for fentanyl. They thought they were just doing cocaine.
Yeah.
Somebody put fentanyl in my cocaine.
Yeah. I've had experiences when I was like a substance abuse counselor where my client would be sober for 8 years, and then he'd go and buy some marijuana off the street just because that's what his drug of choice was at the time, and then he'd come back and drop 34 fentanyl and marijuana, and he'd be like, I didn't use that, and then a whole bunch of snowball effects happened after that. But yeah, it's very common. What were you gonna say?
2 different times. My brother's an ER nurse, and one time we were at a concert, and he came and found someone who was unconscious. We have no idea what substance they ingested, and we just made it so that if they were vomiting, they turned them on their side and stayed until the ambulance arrived. And then when we were at a family party, someone had overindulged in alcohol. The person was also diabetic, and they lost consciousness, and so he responded to that. So those are just 2. I mean, I didn't do that one.
No, yeah, but you know, it's a lot more common than we think. Yes, absolutely. But I'm curious to know, like, in your specific line of work in CERTS, is there any involvement, or have you guys seen any relation with substances at all?
Where we would come in contact it mostly, our teams throughout the county will often staff medical tents at events. For instance, a lot of these people have been at the Mundelein Munch, and there's a medical tent there, and well, people are taking in the music. By the way, the music there is pretty good, and you know, if they're doing some other recreational stuff, and also they've been too long in the beer tent, then we're going to see it there when the people come in. Now, luckily, at most of these events that we're going to be at, we're going to have probably a paramedic there within minutes. But yeah, I think when we talked earlier, we said that was probably our most likely scenario. One of our members is at a medical tent at an event over the summer or a parade, and they bring somebody in that, you know, well, it's the heat or a little bit too much to drink, but recognizing it for what it may very well be becomes important.
Yeah, that's what I was just about to say. Maybe it's not the way that you would actually be hands-on, but more of like the visual observant way of knowing, like, and identifying who in the crowd that we're observing or there to serve needs our help. That we can kind of point them out and like approach them, or at least try to get them medical help.
Even keeping with the tent, as we mentioned at events, one of our peer organizations staffs tents worldwide at concert venues, and they provide test kits, which is vital these days. We do not go in that direction. We're about education this particular organization though is boots on the ground at venues in the tents, testing drugs, providing water, providing other services that are safety oriented and preventative. But there are organizations that do specifically that.
The other scenario for us, we are trained to do searches, especially after disasters. And you would come into a scene where, you know, somebody may be in a house, that house is partially wrecked. Who knows what they were doing? And they may have various ailments, or they may have been taking various things. And so, you know, our first contact with them in that scenario would be very different, because we may not have, you know, full professional help available for some time in that scenario.
I am glad you really mentioned the mental health part of it though, because you can see some schizophrenics or people with brain injuries that do act a lot like they're on drugs and they're not.
Yeah.
It's just that they do have some sort of mental illness.
Yeah, and I wish there was a better way to differentiate, honestly.
It is
It's
difficult.
really
Sometimes I don't know until I've tested them, because I'd be convinced they're on something and they're negative for everything, and then you realize they're mentally ill.
Or, I mean, I don't know if you've ever run into a situation where you ran into someone who is mentally ill and they're not taking like stimulants or hallucinogens, but they may have been taking benzodiazepines to, you know, as their psychiatrist has prescribed, you know, and that could be also misunderstood. So there's so many different situations, and there can be a lot of room for error there for sure.
It also has to do with autism too. If people don't understand what's going on with autism,
Absolutely.
and they think that they're mentally ill or they're on drugs, then it's a whole other story.
Yeah. I hope that more research comes out in the next couple of years to help differentiate that.
I wrote a program about a music teacher. I wrote a program for autistic children, and I know what that does to them. It's amazing, but it took a lot for me to understand it. And I understand that a lot of times first responders didn't understand what was happening, and they think the person is violent, and they're not. But they didn't get the education either. A lot of professional people haven't had that.
Yeah.
I didn't have it until I did on my own, and all of a sudden you're presented with a group of kids.
Yeah. And I forget the name of the app that we had made in the foundation. What's it called?
Full code.
Full code. And do you guys want to speak on that app? Because I think it's a great thing. For sure.
Well, we did in the presentation.
Oh, you did?
Yeah.
I wasn't listening. I was checking.
Yeah. No, it is a great thing.
But yeah, it's a
And
great
what's
thing.
really good about it is that all the 139,000 and counting have taken the training, and it takes, I think, like 15 minutes to go through the whole case, and that means they finish it. And it's not easy. I was told that by some of the fellows from Osmond.
I would.
But it's a hard thing to do, and what it shows symptoms, but it doesn't say one thing about that. Right, it's not right, but it's based on right, that they take the drug with that. So it's really good. But this doesn't really have to do with drug unless you've had an opioid. It was cut with an opioid, I don't know, but as you mentioned about Narcan, something I just heard with the last first responders presentation we did was that the Narcan is often given more than once. I just heard that.
Yeah.
And it can't hurt them even once, like you do it a minute later or 2 minutes later.
No. Yeah, normally nowadays it takes anywhere from 2 to 4 doses of Narcan to wake someone up, to bring them back home.
Just to piggyback off what you were talking about, the combination of the drugs, so, you know, with like mixing fentanyl with like ecstasy in this case, you've got 2 different sets of symptoms going on at the same time. It's a little more complex.
Correct.
The other thing is, you know, I've got experience with autism, and that can really look like an overdose of stimulus, and then with some of the behavior of them completely just doing their thing as an autistic child. You know, they can have meltdowns and act agitated and have all those things.
Yeah, again, I really hope that within my world of line of work in the mental health world that we actually dedicate time to do research to try to help first responders differentiate between that, because it's something we see now too often.
And that's why we say that patients not criminals.
Exactly.
Well, one of the things I recently learned, is gabapentin, which is prescribed for multiple things, is actually considered an enhancing drug. So with certain drugs, when you take gabapentin, it increases potency of that other drug. Like, so you have to be very cautious, and not everybody is aware of that. So, and again, if somebody's just taking a regular prescription for gabapentin, and then you take something else, it's going to do way more to you than it normally would, and there could be overdose issues based on with your prescription.
Yeah, that's something that we actually talk about in our community presentation as far as the mixing of different substances, and we try to educate them and try to give them resources for them to look up themselves in the moment. Like, is it safe for me to do cocaine while I'm doing ecstasy? Probably not. Because they're two opposites.
Even over counter, I don't think doctors are also going over and telling people, you're on gabapentin, this is an enhancer. So be careful if you decide to take some NyQuil or Dayquil. It's going to have, or Benadryl, it's going to have an effect on you, and that's not necessarily being educated.
And I would also like to add that if it weren't complicated enough, with social media today and internet and purchasing online, there's what is called fentanyl now, where, and this knows no socioeconomic boundaries. Every community is prey to this. Everywhere. There's no boundaries that prevent this, whether it's Lake Forest or Waukegan across the world. People are ordering these, what they believe are Xanax, Percocet, typical prescription drugs that they might have ordinarily had from their doctor. They're ordering them online through Snapchat and etchy menus, and they're
colorful.
They're delivered inexpensively to their door in 2 days by UPS. And these drugs are being manufactured by the cartel, utilizing fentanyl that comes from China to the cartel, and they're fabricating these drugs. It's big business. It's big business, and it's causing a lot of death.
You remember Dr. Memorial? She had one son on the 16-year-old, and they didn't even know.
Yeah, the digital world has definitely made the life easier to have access. Sorry, you've been trying to say something for a while, so I'm gonna let you go.
Just when you were talking about not being able to differentiate, one thing I've heard is if someone is having mental health issues, then people's probably going to respond the same, so that the people's might be the ones also.
Yes, but it's hard to get very close to a mentally health, like somebody who's schizophrenic. You don't want to be all up in.
You can try.
Yeah, you gotta try. You know, like it can be difficult. Yeah.
Yeah, for sure.
And people with psychosis is IS. So that's not, that won't necessarily be.
That was Shelly.
I was always thinking to some people that my daughter noticed it was something wrong and
yeah.
She didn't say I'm working too. But she said what's going on emergency.
And I think you answered our second question is like, how are you currently thinking of using this information in your daily work? I think it goes back to the observation of events instead of not always being like the first one to give Narcan or something like that, maybe observing the crowd that you're in and trying to point out who needs help. Would you agree?
Toulouse. Yes, no, I would agree, but and I think you had brought it up in the earlier questioning. We're not that proactive. Unfortunately, we're somewhat stationary, and people will be coming to us in a medical aid, first aid scenario. Now, in other scenarios where we're out there and we're looking for people, the other thing is that some of our members are extensively trained through Illinois Search and Rescue. And, you know, you'll hear those quite frequently in the news that, you know, there's a missing person search. And there is, for those of you who don't know, there is an Illinois search and rescue team. They give specialized training. And, you know, we've been out in forest preserves. We've been out in wooded forest areas, you know, looking for people that are missing. Now, very well, the scenario may have been that they may have had some type of overdose situation, mental illness, as we hear today a lot, combination of both, and then you run across people on it. But we're not that proactive that we're watching people and coming up to them. The police may be, but not typical for us.
Well, I hope that at least some of this information that we provided today, hopefully the majority of it, right, has been able to stick, has been able to be something that you can see as a tool for your future and especially your work here. And we obviously thank you so much for giving us the opportunity to be here. Every single time when we give this presentation, we try to just get 1% better as far as not just the presentation, but just the community at large. So again, I know it's hard. Yeah.
That we learned in our presentation to underline these points recently. Terrific. They're phenomenal points, by the way. Really terrific individuals, but one of them mentioned at the tail end of the presentation that we learned from the presentation that it's not enough for them now to ask what may you have taken recently, but what may you have taken within the last couple of weeks, because there is a lasting effect, and our son suffered from that as
especially with like a sleep.
Yeah. Yeah. So the symptoms aren't just on that day or the next day. It can be for the next several days, up to a week, 2 weeks. The effects can still be there, and it can still be life-threatening at that point.
Yeah, like the fact that you mentioned about talking calmly and quietly, but I think it's also important to remember, and you say, I learned this with autistic children, that it's very careful of how you touch them, if you touch them, or don't touch them.
Correct.
Because, and that's not just children, that's also with autistic adults, and they can freak out with that. And right away, it looks like they're being violent, but they're not. It's just, it's reaction.
Yeah. Especially if someone who's agitated. You don't want to put your hands on them at all. Thank you for mentioning that. We should include that in the presentation for sure. Are there any other questions before we get to a close? Any other comments?
Thank you.
Yeah, of course. I do have one last thing. Again, it is not graded, but we do have a post test just to see how effective the presentation was as far as your learning experience. And at the end of it, there is a place for feedback of any kind. It can be good, positive, anything in between, things you guys want to see more of, things you guys want to see less of, what was helpful, what was not helpful. Any type of feedback is more than welcome. So thank you again for your time. I appreciate it.
Yes, the survey has been emailed
Oh,
to
really?
everyone on the CERT team.
Perfect. We don't need to.
So I get it. There's an email address they can send back to.
The one that you get.
Yeah.
From.
Yeah, I just sent that to
Okay.
everyone during the presentation.
Okay.
Yeah. The other thing is, do you have? I'm sorry. Go ahead.
No, the pretense.
Yeah.
Before.
Was supposed to happen before the.
Okay.
And the post test was the same thing, just to see the difference in your
Yeah.
answers.
Yeah.
But you did the pre-test, you just take the post test.
No, we did the pre-test.
Oh, everybody
Yeah.
did.
But do you guys have the link for the post?
No.
Okay.
Yeah. So one was sent. You may want to check it. Also, do you have the PowerPoint that you can send? No? Send that to me,
Yeah.
and I will email that to everyone also.
Yeah, I'm sorry about that. We will never forget it.
Well,
This has been very helpful.